everyone, welcome to a short video where I'm going to discuss and demonstrate for you some principles related to sterile technique or sterile asepsis. So when we talk about sterile technique, we have to understand that aseptic practices maintain an area that is free from pathogens. We're always concerned about pathogens because, of course, they can cause infection. Most of the time, sterile technique is utilized in the operating room, in labor and delivery areas, but it's also utilized in some of the major diagnostic areas where procedures are being done, perhaps even at the bedside. Things like inserting an intravenous IV line, doing wound care, or inserting a urinary catheter. So when we talk about surgical asepsis, there are several principles that are involved, and they include that all items that are within a sterile field must remain sterile. We also know that a sterile barrier that has been permeated by any type of puncture or tear or liquid must be considered contaminated. We also know that once a sterile package is opened, a 1-inch border around the edges is considered to be unsterile. We also know that tables that are draped as part of the sterile field are only considered to be sterile at the level of the table. So that means that anything hanging below the level of the table is considered to be contaminated. Sterile technique is a team effort, right? It's not just really one person. It's everybody that's involved in that particular procedure. And with that being said, if there's any question or any doubt about the sterile field being maintained as sterile, then it should be considered unsterile and sort of have to start all over again. Sterile people or items contact only sterile areas. Any movement around and in the sterile field must not compromise or contaminate the field. A sterile object or the field out of range of vision, so if you cannot see it, or if you hold an object below the level of your waist, it is considered to be contaminated. And then the last principle is that a sterile object or field becomes contaminated by prolonged exposure to air. So when you're setting up your sterile fields, you can't set them up a half hour before you're going to start, right? Because the more time that it is exposed to air, the more contaminated it is becoming. All right, so I want to just first review some things related to the sterile field. So when we have a sterile field, as I have here, keep in mind that this is going to be coming inside of a package, right? And so when we're touching it, we only want to touch it by the corners. When we open up the sterile field, we want to let it sort of unfold by itself and grab the other corner to open it completely. You will find that even though this sterile field happens to be blue, they're either usually white or blue. Keep in mind that one side will be sort of dull looking, while the other side will be a little bit on the shiny side. I don't know if you can appreciate that on the video. But when you're lying down your sterile field onto your table, you want to make sure that that shiny side is going down, because that is your moisture barrier. So when we place this sterile field down, we want to make sure that that shiny side is going down onto the table. Let me just tilt this a little bit more, and I'm actually going to bring over my little side table so that you can get a better appreciation for what I'm doing. So I take this sterile field and I put it down on the table as such. We never flap around the sterile field, okay? We only touch it. Remember I said that 1-inch border, so we're only touching it by the corners. So once we have that sterile field in place, I can adjust it by touching only those corners, right, by that 1-inch border. Let's talk a little bit about putting on sterile gloves. Sterile gloves come in packaging to maintain their sterility. So when we put these this packaging down, we cannot put it on top of our sterile field because obviously I've been touching this with my bare hands. So let me move my field just for a moment so that I can demonstrate putting on these gloves. First and foremost, the package opens. When it opens, you're going to notice some writing on the inside. It's going to say thumb on the left, thumb on the right. So it's basically telling you which glove is for which hand. When you are putting on sterile gloves, you want to don your dominant hand first. In this instance, I'll be using my right hand because I am right-handed. When opening up the package, you'll see that there are some tabs here, okay, on the edges of the packaging. There are some tabs that you're going to be grabbing in order to open up this package. You want to open up the package fully. Okay, again, only touching that 1-inch border on each side. Once you have the package completely open, it's time to put on your gloves. So again, I'm going to don my right hand first. I'm going to pick up this first glove by the cuff. All right, I'm holding it by the cuff. Always remember that the cuff on a sterile glove is considered to be contaminated. You'll notice it's kind of inside out, right? Because that portion is going to be touching my hand or my wrist, so I can go ahead and touch that cuff. I then am going to open up this hole a little bit just for ease of placement of my hand. I'm going to put my 4 fingers together and I'm going to tuck my thumb in like this. I'm going to go into the glove palm up, because that is where I'm going to find that thumb in order to get my thumb in there. I'm going to wiggle around my fingers to get them inside of the glove, and I'm going to stop right there. I'm not going to touch this cuff. To unroll it, I'm just going to stop right there. Now I have to pick up the second glove. I can't pick it up in the same way that I picked up the first glove because, again, that cuff is considered to be contaminated. So I'm going to take my 4 fingers, I'm going to keep my thumb really far out because I don't want to use my thumb at all to pick up this glove. Now you'll notice I took my fingers and I kind of wiggled them underneath the cuff, and I'm going to pick up this second glove. Again, with my left hand, I'm going to put those 4 fingers together. I'm going to tuck my thumb, and I'm going to now slide those 4 fingers in, kind of wiggling a little bit to get my fingers into the glove. And these fingers are pulling down that cuff at the same time. Now I can take my left hand and fix the cuff on the right. Once I have my gloves and my cuffs all the way down, I want to make sure that these sterile hands stay above the level of my waist at all times. I also want to make sure that I don't do any, sort of kind of habitual things, like fixing my hair or picking up my glasses, right? Because that's going to contaminate my gloves. Usually I find the best thing to do is to kind of fold your hands and your fingers together and just keep them above your waist, right? That's the best thing to do to keep them nice and sterile. Okay, so I'm going to remove these gloves and I'm going to open up a wound care kit. And I'm going to show you the pieces inside the wound care kit. First of all, when you're using any type of kit, I want you to make note that on the front of the package, there will always be a list of everything that's inside the package. So if you need something else, you're going to bring it with you along with your kit. So in this particular kit, I have 2 pairs of sterile gloves. I have a drape. I have 2 rolls of medical tape. I have a bottle of sodium chloride. I have what's called an abdominal pad. I have a reclosable bag. I have 10 4 by 4 inch gauze sponges, and 1 rolled bandage. So a lot of stuff is inside this kit. So there's always going to be directions on how to open the kit. If you can see, there are some arrows and it says peel here, right? So I'm going to grab the end of this and I'm going to start peeling it open, okay? And I'm going to peel it all the way back and sort of wrap it underneath. Then I'm going to put my box onto the table that I am using. Now, keep in mind that these boxes, the equipment that's inside, comes in the order in which you are to use it. So I can't be putting my fingers down there and digging in that box to get any of that equipment out of there. I have to take it out in the order in which it is placed in the box. So right on top, I see that there are 2 packages of sterile gloves, okay? I have both my sterile gloves. I'm going to take these and I'm going to just put them to the side for a moment. The next thing that I see in here, hopefully you can see it, laying right on top, is my sterile field. So I'm going to examine a little bit where is the corner of this sterile field. And remember that 1-inch border. I'm going to grab a corner. Let's see where I'm at here. Okay, I'm going to grab right here. I'm going to grab a corner and I am going to open up this sterile field and sort of let it fall open. Remember, we're not going to do any of that, shaking or fanning out. I want to show you one thing with this sterile field for just a moment. You're going to see that there's actually 2 layers to this sterile field. I'm not peeling those apart, okay? In the in-between layer is my moisture barrier. So I have this by one corner. I have this by one corner. I am going to lay this sterile field down and I'm going to grab these corners to open up this sterile field. Again, just touching that 1-inch border. I want to make sure that I am not contaminating any portion of my sterile field. Now, everything else that's in this kit, I cannot touch at this point, right? Because I need to put on a pair of sterile gloves. So again, I'm going to open up this package, right? Kind of try to uncrease it a little bit. I'm going to open it up this way, and then I'm going to take those tabs on either side, and I'm going to open those gloves. Again, I'm picking up the first glove by the cuff, 4 fingers together, thumb tucked. I am going to put my hand in palm up. And when you're putting sterile gloves on, don't put them on going down. Put them on going up, right? So, because remember, you got to stay above your waist. So first glove is on. Second glove, I'm taking those 4 fingers, I'm spreading my thumb out, and I am going to pick up that second glove by the inside of the cuff, right? The inside of the cuff. Taking this hand, 4 fingers, thumb is tucked, I'm going to go right into here and get this glove on and pull that cuff down over my wrist, and now I'm going to go inside this cuff to put that glove on completely. Again, I want to stay above the level of my waist. Now I'm free to touch everything that's in this kit. So let's see what we have. So first of all, I have this large piece of gauze, which is referred to as an abdominal pad. I'm going to put that onto my sterile field. Next, it looks like here's my reusable bag with a little twist tie. I'll just toss that away. Here's my basically my garbage bag, right? Okay, I'm going to put that on my field. Next, it appears I have some gauze pads. They come with a little piece of paper around them that you just rip open. I'll put that on my sterile field. Now I see my rolled gauze. I can put that on my field. It looks like they gave me a label, right, for when I do my wound care. It also looks like they gave me a wound measuring device. I'll put that on my field. Now I see a bottle of normal saline. I can put that right on my field. And then the 2 rolls of tape. Okay, all of that goes onto my sterile field. Now, when you are this, as I said, this kit is for for wound care. Okay, and again, keep in mind with the kits that they always come with a list of what is in the kit. So make sure that you look at that before you go into your patient's room to make sure that you have everything that you need. Now, if you need to add something to a sterile field, let's say I'm going to take my sterile gloves off. You remember from the PPE how to take off gloves. I'm going to grab here by the wrist. I'm going to pull this off inside out. I'm going to ball it up in my hand. I'm going to go underneath the cuff, and I'm going to take this glove off inside out so that I am not touching any part of the outside of the glove which is contaminated. All right, let's say that I need to add something to my sterile field. Let me just grab a piece of equipment here and something that we can add to our sterile field. So I'm just going to add this butterfly. It's used to collect blood. But I just want you to get the principles down, okay? So again, there's always going to be a way to open the package. So in this instance, there's a little pull tab here, okay? You can kind of see it there. I'm going to peel this open, making sure not to touch the inside of the package, right? Because I can't contaminate that. It's going to go on my sterile field. So I'm going to open that, and I'm going to take this and put it in the center of my sterile field. I don't want it on the edge because, again, remember that 1-inch border that is considered contaminated. I'm going to go a few inches above the sterile field, and I'm going to just dump that into my sterile field. Now, please keep in mind, hopefully it will make sense to you, that when you're adding things to the sterile field, you cannot have sterile gloves on, right? Because I would be touching the outside of this package, which is contaminated. So you want to make sure that everything that you need on that sterile field is on the field before you put your sterile gloves on, okay? So that's a really important point. You want to make sure that everything that you need on your sterile field is on the field before you put your sterile gloves on. Because once those gloves go on, you can't touch anything that is not sterile, okay? All right, so essentially that is pretty much the basics of setting up your sterile field. Remember that, you know, the big thing about sterility is all about protecting our patients from infection, right? Particularly when we're doing invasive procedures where there is the potential for contamination, and that could cause wound infection, that could get patients very sick, sometimes even life-threatening. And one of the things also that is important to note, that before you are setting up your sterile field or putting on your sterile gloves, you have to perform hand hygiene, right? And hand hygiene would involve washing your hands with soap and water. So in terms of getting ready to do any type of sterile procedure, think about these things. Identifying your patient. Identify your patient by name and date of birth, which are our two patient identifiers. You want to assess your patient for any allergies, in particular to latex, right? Because a lot of equipment that comes in these types of kits could contain latex. You want to make sure that your patient is comfortable for whatever procedure it is that you are doing. You want to make sure that you're explaining to your patient what you're doing and why you're doing it. Before you get ready to open up your sterile package, you want to inspect it for integrity. Remember, one of the principles was that if there's any tear or moisture or anything, it's no longer considered sterile. So any package that's already open, even if it's open a tiny, tiny bit, is considered contaminated. You have to get a new package. The other thing that you want to do is check the expiration date. Many pieces of sterile equipment and things that we use for sterile procedures do have expiration dates, so you want to make sure that you check that as well. Again, make sure that you're anticipating the supplies that you need so that you don't, have to keep stopping and removing sterile gloves because you forgot that you needed something on your sterile field. You want to make sure that you have an area to work in, right? You can't ever work on top of a patient, right? So in other words, your patient's in bed, you can't open the sterile field on top of the patient. You can't open your sterile gloves on top of the patient. So make sure that you have an area to work on, a side table, right? Or the overbed table, something that you can utilize to set up this sterile field. You might want to even clean off that area with an antiseptic wipe before you set up that sterile field. Make sure that, again, you're performing that hand hygiene before you start anything. And then open up your packages. Set up your sterile field, keeping in mind that 1-inch border. Get all your other supplies into the center of that sterile field. Now, I do want to show you one other technique that you might see in the clinical area. So when we first opened this kit, we put everything on the sterile field by basically taking it out piece by piece with our sterile gloves on. So in some places and in some nurses' practice, what they may choose to do is they may choose to I'll use the word dump. They sort of want to dump everything onto their sterile field, okay? So if I just sort of pack this back up again, okay? So we took out those 2 packages of sterile gloves. We have our sterile field placed right here. I have this package that had all my other supplies. Instead of putting on my sterile gloves right now and taking these things out piece by piece, I could dump the contents of this tray onto my sterile field. Here's the issue with that. If you have things that are round, right, things that are heavy, okay, they potentially could roll right off your sterile field, and that's a waste of equipment. Okay, but I will show you. I'm holding this box on the outside, right, because I can't hold anything on the inside. I'm not wearing sterile gloves yet. So what I can do is I can take this box and I can dump all this equipment into my sterile field. So here we have the perfect example of why this is really not the greatest technique. I want you to take a look at these 2 rolls of tape that are here, okay? And I want you to make note that one of those rolls of tape is within my 1-inch border on my sterile field. So what are your thoughts about that roll of tape? I'm hoping that you're saying that this roll of tape is contaminated, right? So I can't use that roll of tape. So that's the problem with sort of dumping your tray, is the potential for things to be at the edge of your sterile field or for things to even roll off of your sterile field. All right, a couple of other things about the sterile field. There are some rules about movement around the sterile field. So first and foremost, I can never reach over my sterile field. If I needed this roll of tape that's here, sorry, I moved it out of the picture. There it is. If I needed this roll of tape that was here, I would have to actually walk around my sterile field to go pick that roll of tape up. I cannot do this and reach over my sterile field. And when I'm walking around my sterile field, I have to always be facing the sterile field. So I can never turn my back on a sterile field, right? Because my back is considered to be more contaminated than my front, all right? Other things about the sterile field I mentioned before, if the sterile field gets moist or wet, then it is considered to be contaminated. Why? Because organisms can use capillary action to move through that moisture across your sterile field and contaminate your supplies. And of course, this is happening unbeknownst to you because you can't see those organisms, right? They're microscopic. So if the field gets wet, we have to start all over again, okay? If we cross over the field like this, it's contaminated. You got to start all over again. If I turn my back on the sterile field, I have to start all over again. If I accidentally sneeze onto my sterile field, it's contaminated. If another practitioner is standing on that side of my sterile field, and I'm on this side of the sterile field, and we are talking over the sterile field is contaminated, okay? So keeping all these things in mind when you are setting up your sterile field is extremely important, because you must remember that ultimately we are protecting patients from infection. And that's why we are paying strict attention to this sterile aseptic technique. Okay? All right, so we'll sort of, when in the other videos on doing wound care and CVAD care and putting in Foley catheters, we're going to revisit all of this sterile stuff, because all of those procedures are sterile procedures. So thank you for watching, and I shall see you soon.